Hello, my name is Lindsay Lefort. I'm an RN and I'm going to be teaching you about the management of gallbladder disease. First off, let's start out with what is a gallbladder? It is a storage organ. If you take a look at this picture, it shows you that your gallbladder is a small pear-shaped organ that sits under your liver in the right upper quadrant of your abdomen. The gallbladder stores bile. Bile is made in the liver and is stored in your gallbladder. When you consume food, your gallbladder squeezes out the bile to help digest and break down your food, especially fat. When you consume food that is made up of fat, your gallbladder empties the bile into the common bile duct. The bile duct then carries the bile into your small intestine to help aid in the digestion process. Whenever you have gallbladder disease, your gallbladder works differently. A gallstone may become lodged in the common bile duct or in the gallbladder and cause a gallbladder attack after you consume a meal that is high in fat. Gallbladder disease can be from cholelithiasis, which is also known as gallstones, which are small crystal-like stones that form inside your gallbladder or in the common bile duct. Or it can be caused from cholecystitis, which is sudden acute inflammation of the gallbladder. There are 4 main risk factors that contribute to gallbladder disease, and they are known as the 4 F's: fat, female, fertile, 40s. Other risk factors that contribute to gallbladder disease are having cirrhosis of the liver, having Crohn's or irritable bowel syndrome, a family history of gallstones, having recent weight loss surgery or recent weight loss, being on birth control or oral contraceptive medications, having type 2 diabetes, a lack of exercise or a sedentary lifestyle, and consuming foods that are high in fat. Symptoms you may experience when you have gallbladder disease consist of right upper quadrant abdominal pain after a greasy or fatty meal. This pain can radiate to your back, to your right shoulder, or between your shoulder blades. You also may experience nausea and vomiting during an attack or after you consume high-fat foods. There are 2 ways that you can manage gallbladder disease. One is diet management. It is important you eat a healthy, balanced diet that consists of plenty of fruits and vegetables, plenty of starchy carbs, which include bread, rice, cereals, pastas, potatoes. Also, it is important that you consume milk and dairy products that are low in fat, and meats such as fish and eggs. It is very important that you limit the amount of foods that are high in fat and high in sugars. It is also very important that your diet is high in fiber. Foods that are high in fiber can be found in beans, vegetables, oats, and whole wheat products. It is also important to remember to drink plenty of fluid, such as water and herbal teas. You need to remember not to eat too much fat at one meal time, and it is also important to remember to eat smaller, more frequent meals. Some people find that different foods trigger gallbladder attacks. You should avoid these foods. You should also always remember to cut down on fatty and sugary foods. A high-fat diet or high-fat food can cause discomfort and painful symptoms. They also may cause statorrhea, which is a sign that fat is not being digested properly. If you take a look at this picture, it shows you the second way you can manage gallbladder disease, which is through surgery. There are 2 types of surgeries that can be performed to manage gallbladder disease. The first one is laparoscopic cholecystectomy, and the second is open cholecystectomy. Laparoscopic cholecystectomy is where the surgeon makes 4 small incisions in your abdomen. A tube with a tiny video camera is inserted into your abdomen through one of the incisions. Your surgeon watches a video monitor in the operating room as a special surgical tools are inserted through the other incisions in your abdomen and your gallbladder is removed. The second type of surgical management is open cholecystectomy. This is when your surgeon makes a 6-inch incision in your abdomen below your ribs on your right side. The muscle and tissue are pulled back to reveal your liver and gallbladder. Your surgeon then removes the gallbladder, the incision is sutured, and you're taken to a recovery area. Open cholecystectomy is a lot less common today, and it is important that you remember that if complications do occur with a laparoscopic cholecystectomy, an open cholecystectomy can be performed. I hope you learned a lot, and I hope you now know how you can manage gallbladder disease. My video can be referenced from WebMD, Mayo Clinic, and Medical Surgical Nursing, Patient-Centered Collaborative Care 7th edition by Donna Ignatavius. Thanks for watching. Bye.